This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Coming up on today's show, they reached a milestone at the Mon Health Heart and Vascular Center recently. They've now done 500 Watchman procedures. We'll talk about that. We'll talk about the Watchman. We have mentioned it on this program certainly before, and we will jump into, of course, several different topics as the show moves on today. Our guests today are Dr. Wissam Gharib and Dr. Salam Sbaity. Dr. Gharib, good morning. How are you, sir?
Good morning. I'm doing great.
Always fun to have you on the show. And Dr. Sbaity, good to have you on this morning as well.
Good morning. Thanks for having me.
Absolutely. We usually do background and where you came from, but Dr. Gharib, we've had you on so many times. How about just an update? How are things going recently?
Things are doing great. We're doing very well. You know, we've are on the other end of the pandemic, hopefully, and everything is picked up actually a little bit more than we expected after the pandemic. So things are going well. The patients are coming back to the hospital, obviously. We're doing a lot more cases and patients that had held and kind of postponed their procedures. So now we've picked all those back up.
Remind folks again, what is your specialty?
So I am an interventional cardiologist. I specialize in structural heart disease, which means obviously we do balloons and stents and the like, but also when people need valve replacements or what we're talking about this morning, a Watchman implant, I'm one of those specialists that do those. And
Dr. Sbaity, what's your specialty?
So I'm a cardiac electrophysiologist. I take care of the heart rhythm abnormalities. It's people who have abnormal rhythms and electrical problems in their heart, causing fast or slow heart rhythms.
And I mentioned right off the top of the show, I want to get into this because this is quite the milestone. Now, 500 Watchman procedures that have been performed with the Mon Health Heart and Vascular Center. First of all, Dr. Gharib, can you believe there's been that many procedures over this time?
Honestly, it's happened so quickly, and with all that's happened over the last couple of years, it is a huge milestone that we've accomplished. And to accomplish it in such a short period of time, it's really astounding.
What is the Watchman?
So when someone has atrial fibrillation, there's multiple things that we treat them for, but one of the major things we worry about is stroke, because unfortunately, a vast majority of strokes that occur in people occur from atrial fibrillation, and those strokes are usually much larger and much more devastating. So when someone has AFib, we look at their risk factors, and if they have several risk factors with what we calculate as a CHA2DS2-VASc score, then we put them on blood thinner. Those are like Coumadin, like Eliquis, like Xarelto, like Pradaxa. If someone can't take those blood thinners because of being elderly and falling, because of bleeding, several risk factors that they cannot take those drugs, then the Watchman is an approved device that is an alternative for those types of therapies. So we go into the heart and we place this device, and shortly after we place it, the patient is able to get off the blood thinner. And that's what a Watchman does. It's an alternative for people to prevent strokes when they cannot take blood thinner.
And Dr. Sbaity, when we're mentioning atrial fibrillation, or what most people probably commonly know as AFib, what is that condition and what kind of symptoms does it generally produce?
Very good question. So AFib is actually the most common abnormal heart rhythm. It's estimated that around 6% of people above 60 and 15% of people above 80 have atrial fibrillation. And West Virginia is actually one of the states with an epidemic of atrial fibrillation. It's one of the top 2 states in the country with atrial fibrillation. So basically the heart is a pumping machine, and it has its own electrical system that regulates the pump. It has its own pacemaker that keeps that pump ticking at the right rate. And when atrial fibrillation happens, irregular activity in the upper chambers take over the normal pacemaker of the heart. And thus the upper chambers, rather than pumping regularly, they become fibrillating, which is like shivering. And thus they're not efficiently pumping blood down to the lower chambers. And that causes the blood to sit around in the upper chambers, particularly in the left atrial appendage, and form clots. And that's what causes the high risk of stroke. Also, the lower chambers, which are the main pumping chambers of the heart, now instead of being regulated by that pacemaker, now they are being driven in an irregular and sometimes very fast manner. That can cause multiple symptoms, so mainly palpitations. Now the lower chambers are going really fast, irregular, so people will feel palpitations. They can feel more short of breath at rest or on exertion. They sometimes can have chest tightness. And they might, if they have history of heart failure, they're at high risk of developing heart failure symptoms. And they might have more fatigues and less exertional tolerance.
Dr. Gharib, what's the difference between a Watchman device and the traditional pacemaker?
So a pacemaker is what we give patients that their electrical system starts to wear down. They're unable to coordinate between their upper chamber and the lower chamber. So it takes over the workload of the heart whenever the heart's electrical system has stopped working. A Watchman is only there to prevent strokes. So when you put a Watchman in the patient, you're helping prevent strokes, so they don't need to be on a blood thinner, because that's the only two options. You either take a blood thinner or you're a much higher risk of stroke, and that's a yearly risk that continues to increase as we age. So if you have AFib, you need to have blood thinner. If you can't have blood thinner, you get a Watchman.
We're talking to Doctors Wissam Gharib and Salam Sbaity this morning as Mon Health Heart and Vascular Center just recently performed its 500th Watchman procedure. We'll continue our discussion. Got to squeeze in a quick break first. You're listening to Mon Health Talk on the voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guests this morning, Dr. Wissam Gharib and Dr. Salam Sbaity, Mon Health Heart and Vascular Center, talking about the Watchman procedures. Now 500 Watchman procedures performed at the Mon Health Heart and Vascular Center. And Dr. Sbaity, what are the advantages to the Watchman device over putting a patient on blood thinner?
Yeah, very good question. So blood thinners, again, are given to prevent stroke in patients with atrial fibrillation. And the reason for the stroke is that the upper chambers are not pumping right, so blood is sitting around in a pouch in the left upper chamber called the left atrial appendage. And then clots form, and those clots would break and be pumped forward and cause a stroke. Now, these blood thinners come at a cost, which is the increased risk of bleeding. So patients who are already at higher risk of bleeding and being on blood thinners should consider a Watchman rather than a blood thinner. And that includes the following group of patients. Patients who previously bled, so these are obviously at very high risk of bleed, and putting them on blood thinners would have much higher risk. Patients who are at future risk of bleeding, like if they have balance problems and they already have fallen. Patients who have, for example, lifestyles or occupations that put them at higher risk of injury or bleeds. And also patients who are unable to be compliant with the blood thinners, or who take medications that might not be compatible with blood thinners. So these patients, they still need to be prevented still need to be prevented from stroke, but you don't want to put them on blood thinners. So the Watchman would be the alternative that will put them at lower risk of stroke and prevent stroke basically without increasing risk of bleed.
And Dr. Gharib, the procedure itself to implant or install the Watchman, can you elaborate a little bit more on what that procedure entails and basically what a typical operation to install that would be like?
Right. So the way we do this, we do it a little different than most. We've come up with our own way of doing it because we've done so many. So mainly the patient comes to the hospital in the morning. We take them to the cath lab. We put them to sleep under conscious sedation, which means they're not fully intubated. They're under conscious sedation. We put a needle and a catheter in their groin, and we advance this catheter up to the heart, find the appendage, deploy this device, this Watchman device, make sure, based on the echo results that we're doing simultaneously with this deployment, make sure that this device is the right size and the right shape and that it's going to stay in place and it's covering what it's supposed to cover. And if that's the case, then we release this device, pull everything back out, we monitor the patient, and most patients go home later that evening or the next morning. So we keep it as minimally invasive as possible, and that's our goal because most of these patients that require a Watchman are older, they're frail, and we don't want to put them through a very complex and lengthy operation. So this does help them be able to get in and get out as minimally invasive as possible.
And Dr. Sbaity, it is unbelievable to me that you could go in for a heart procedure in the morning, and if all goes well, you may go home that next night and the very next day. It just speaks to how far we've come with the advancements in heart procedures in general.
Yeah, that's correct. Since the pandemic, we've been actually sending most of our electrophysiology patients same day, which is a significant shift from previously. And we haven't noticed any significant increase in any complications post-procedure with that.
Our guests this morning, Dr. Wissam Gharib and Salam Sbaity, Mon Health Heart and Vascular Center. We'll continue the conversation right after this quick break. You're listening to Mon Health Talk on the voice of Morgantown, WAJR.